So I'm Christy Bird McKeeve, and I'm the executive director of Butte Glen Medical Society, which is has offices in Chico. And I'm also CEO of Healthy Rural California, which is a separate nonprofit 501c3 that is affiliated with Butte Glen Medical Society. Today, we have a slight change in plans. Kiki Nocella is the main presenter, but she's not well today. So Maggie Fassbender is going to join. And I just want to say that Maggie's very accomplished. She was part of our team, and I'll describe that process in a little bit. She's very qualified to be giving this presentation, but we have a hunch there might be some cost reports as a subject that needs to be followed up, and we can, Physicians for Healthy California, and I can record that with Kiki at a later date and then share that with everybody. We have some polling questions. If you could take a moment to answer those, it gives us an indication so that we can map this series and participants over time. Our series kicked off in September. That was about GME partners, and we have another person joining. So welcome. Today is about feasibility studies and business plans, and very important topic. The idea behind this primer started because I had been leading a residency task force for a year, and I'll get a little bit more into that in a bit, but there was just so much that I didn't know and our community didn't know. And as I was sort of penciling out what we wished we'd known, we thought we would do this series, and then of course partnered with Physicians for Healthy California to make it available to everybody in the state. So feasibility studies and business plans was actually number one on my list of things that I wanted to have in this series. In November, Lupe Alonso Diaz from Physicians for Healthy California and colleagues from Song Brown will be joining us November 12th, state efforts to expand residency programs. Where can the money come from is a great topic. And then in December, we'll talk about ACGME requirements. So much has changed in the last decade, and what would residents be expecting from your program. January 7th, funding opportunities is actually going to change slightly because funding opportunities is kind of wrapped up in the November one, but we have Janet Kaufman from UCSF who's agreed to join on January 7th so that we can sort of map out the state of California. Janet's job is really looking at graduate medical education in the state of California. And so what better person to share her data. January 28th is Expand or Create New, that is the question. In February, we will talk a little bit more in depth about our particular program through the Butte Glen Medical Society. And then in March will be the final webinar on certified physicians and why they're key to continuity sites. All will be recorded and available on phcdocs.org. Again, this is all stuff that I wish I'd known a year ago. All right, I keep losing my mouse. Okay, so thank you to our sponsors. Physicians for Healthy California is our partner, actually, more than a sponsor. And then Paradise Medical Group, which was greatly affected by the campfire and very passionate about residency programs in the area. And they've also sponsored this, California Medical Association, and then the Butte Glen Medical Society Residency Task Force. So just really quickly, the tips from our residency task force journey. We established a residency task force through Butte Glen Medical Society in Chico. It's about an hour and a half north of Sacramento. And we did that in response to the campfire last year. And so we started this process in about August and immediately identified psychiatry residency as our #1 priority. Second to that is family medicine or some other kind of primary care effort. But we put that on hold for the moment because psychiatry has become our immediate need and focus. We heard last month that we were awarded a $1.8 million planning grant to establish a consortium for the psychiatry residency. And we have been trying to figure out how those funds will actually flow. The grant was applied for through Butte County Behavioral Health, and sadly have realized that we can't actually have the funds flowing until we are accredited. And that's probably a 2-year journey. to get to. So now we're back into the, how do we move forward and get accredited? But it's all very good. It's brought a lot of great attention to the community, and we're working forward. I recorded in this YouTube link, it's through the Butte Glen Medical Society YouTube channel, about a 30-minute overview of that whole process from starting the residency task force, efforts that had been in prior to the psychiatry residency, and just sort of giving my personal story of the ups and downs, especially with the pandemic hitting. We actually had a $900,000 grant for psychiatry. The pandemic hit, and all of those funds evaporated in March 2020. So it's been really high, great things, and then really low, sort of, how do we move forward? But I wanted to point that out because in that February, March timeframe, we began to realize that the feasibility study was a necessary next step. And that's what led us to today, is that we actually did move forward with the feasibility study, and it has given us the traction that we needed. And I'm really glad that Maggie's going to go through what that means, a little bit more of the meat and potatoes behind it, because they're very, very important. Feasibility studies, business plans, strategic plans, and graduate medical education. So my tips are: keep focused on creating an effective and positive experience for residents to have from the very beginning. The minute they walk in that door, they will be evaluating your program. So the key to both success of the program, but also sustainability, is that you've created an effective and positive learning experience. The journey is resource intensive, and it will take much longer than you would ever think possible. Those are for new residency programs. Some of you already have some residents, and so maybe it's just establishing the next one, or partnering with other organizations to make it happen. Keep an explorer mentality, cast a wide net, create a residency task force, involve everyone, legislators, foundations, maybe even consider your local medical society as a partner who can help be the glue to keep everybody going. And that's particularly true when you're looking at a consortium or community-based program. Prioritize and focus on the greatest need in your community. Again, that's why we came up with psychiatry. We've been in throes of a massive disaster, and then 2020 happened, and we had two more disasters, both the pandemic and the North Complex fire. Our needs are great, especially for trauma-informed care. So hire a consultant. It's always good to have somebody from outside of your community to come in and be your partner. And I did mention earlier when we were getting started, or before we started, that the California Healthcare Foundation has embarked on a program, and happy to hear that Mathematica is being represented in this call. Thank you for joining us. The California Healthcare Foundation's website has more details on what they are doing. And so I'm going to introduce Maggie. Maggie was a part of our feasibility study this spring, although Kiki was the lead. Maggie was right there with her, and so I'm very happy that she could join us today and share. And I'm going to stop sharing my screen so that you can share yours.
All right, thank you, Christy.
Yeah.
It's my pleasure to be here. I'm sorry Kiki couldn't make it. Let's see. I want to make sure I'm sending the right one. Can you see that all right?
Yes.
Perfect. Well, thanks, Christy. I appreciate you taking the time out to have us speak to this group, and welcome everybody. So just a little introduction to my experience. Yes, Kiki is most definitely the GME whisperer. Just cannot believe how much information and knowledge she has. It's insane. My experience in GME and graduate medical education is about 13 years, primarily in program operations and program startup in both the academic setting, university setting, and also for Kaiser Permanente. I joined Whipfly in December and partnered with Dr. Nocella to further her work in GME strategy and startup, and also in workforce planning and development. let's get into this. Hopefully, I'll be able to answer some of your questions. I do have to say that cost reporting is not my area, so I will note any questions. And like Christy said, we will record her answers for you and post those as well. So, why do you want to conduct a feasibility study and a business plan? Well, there's a number of reasons. First is to assess barriers and facilitators and to find out who your partners are, and to get the information that has not been said, the things that people are thinking that have not really been said out loud. Uh, you're also going to educate and level set the group so that everybody has all of the same information and is all on the same page so that they can make an appropriate decision. You also determine the gaps as compared to the ACGME program requirements. One of the things that we do is we actually look at all of the program requirements for that specific specialty that you are considering. And we take a look at the gaps and start developing potential resolutions to address those gaps. We also provide financial models, and you want to understand how the given project is going to impact each entity. We develop timelines and milestones so that you understand what the picture looks like. As Christy said, it's a long process. You want to know what the key milestones are along the way. We also engage the group in decision making. And like I said earlier, we provide everyone with the same information so that they can make that decision as a group. And it's part of due diligence. It's a best practice. And it also provides a great solid foundation for any grant applications and also for the residency application in and of itself. So we're going to look into what a feasibility study looks like. This is the list of items that we're going to review. I will go through them each one by one. So we do send an email of the engagement in the process. We conduct key informant interviews with all of the stakeholders. We send data requests to any of the participating hospitals and ambulatory clinics. We review cost reports. We look at who's GME naive, what the DGME and IME look like, and so forth. We will also develop a draft rotation schedule so that we can develop our financial models. If it's a family medicine residency that you are considering, then we're looking at the floor plans. We also, I mentioned financial models. We review those with the CFOs. We provide governance options. We develop the action plan and the timeline, and we develop the key decisions and review all of those with the stakeholders. So let's take a look at the first step, the key informant interviews. This is actually probably one of my favorite parts of this entire feasibility process, mainly because we get to know everybody. It's pretty simple. You listen and you educate. Uh, we do have questions that are prepared, but you don't necessarily stick with them. You let the conversation flow as it needs to, and you develop rapport with all of the parties, and you find out what it is that they're thinking, how they envision the residency program. Do they think it can be, how do I say it? Do they think it'll, come off the ground? Do they really want to participate? Or do they have questions? Are they misinformed about things? You get everything out in the open and you clarify any doubts they may have, and you provide information and you give them data, and you ultimately you build trust. And it's amazing how much information you get from your stakeholders just by conducting your interview. The next thing we do, or actually, and this is all concurrent, we send out a data request to any of the participating sites. So what we're looking for is basic financial data, and we're also looking at clinical values. It's important to know if a given site has the appropriate volumes and demographics to provide an adequate training platform for the residents. We also, take a look at best practices. We offer up suggestions if we see something that could be improved. We review financial data. Um, we look at whether they're receiving GME reimbursement or not, if they're GME naive. We make some assumptions on grants, on fundraising. We look at physician expense data. We look at clinic revenue and expense data. And again, we're looking at volumes. We're also looking at historic cost reports. It's public information, but it requires unique experience and expertise to understand. And this is one of those areas that Kiki is an expert in. Um, we want to know if the hospital has established its direct or indirect caps. Have they inadvertently established its per resident amount? We've had instances where a hospital took on residents 30 years ago and current C-suite wasn't aware that that happened. And we find out that they got zero. So these are the sorts of things that we look at when we're conducting our feasibility studies. Um, Part of projecting the DGME and IME reimbursement is to build a mock block schedule or rotation schedule, and also determine the number of residents that you are looking at having. Part of determining that financial aspect is to build, like I said, the mock draft rotation schedule. I call it a block schedule, and I see rotation on the slides, and it's throwing me off. Um, it provides a picture of any gaps in the curriculum. Do we need to go to outside rotations to reinforce and to come up to standards? And it provides a better accurate projection of what the reimbursement is going to look like for each of the individual sites. An example of seeing a need for outside rotations was actually when we needed to go to Valley Children's for the Tulare Family Medicine residency. Um, we made contact, we created the PLAs, and the residency has what it needs, because the hospitals that we were working with in the interior hospitals did not provide the volumes that we needed to give the residents an optimal experience. So part of reviewing is the floor plans. Family medicine has some very specific requirements for residencies, and it's built around the family practice site. So we take a look at what the floor plans look like. Do they have the adequate number of clinic rooms? Do they have the workspace? Do they have the library? And is there a need for major remodeling? Excuse me. What would the costs be? Those costs are incorporated into that financial model. So once we have the data, the clinical volumes, the DGME, the IEME or the IME, and our any potential extra costs, we develop the financial models, and those are reviewed with the CFOs. We look at startup costs as well as a 5-year budget for operations that include total costs and a profit and loss by entity, including any impacts to the clinics. One of the other things that we put together are your governance options. So who's going to be the sponsoring institution in this program? Is it going to be one of the hospitals? Will it be the ambulatory clinic? Is there a nonprofit entity that is willing to be a sponsor? Will the government do it, whether it's a city, county, or other government entity? Is there an academic institution that's willing to either already be a sponsor and take on the new program, or create sponsorship with a new academic institution? Or are you building a consortium with a number of parties? What this looks like is the the considerations for retention. When you are looking at your governance and who's going to be the sponsoring institution, one of the things you want to consider is who is going to be retaining those residents at the end. So when you have a consortium and you're building your residency program around a number of entities, you are giving the residents the ability to be able to go either to their clinic site and stay on after graduation, or stay in the continuity practice site, which was where their clinic was, or go on to a hospital and you know within their training program. One of the other things that we do as part of the feasibility study is to develop the action plans and the timelines. Everything ties to the ACGME's institutional and program specific committee dates. We have those all on calendar. And you basically plan your timeline based on the agenda deadlines, knowing that in order to be on the agenda, the program already has to have had its site visit. So the application needs to be submitted approximately 2 to 3 months before that even happens. You know, not everything the ACGME does is crystal clear, and lots of things have changed because of COVID. For example, they have moved from in-person site visits to Zoom site visits, which has completely changed the landscape of how things are happening right now. Everything is in the standards. Program requirements contain everything you need to build out your program. If it's not in the common and program specialty program requirements, it's going to be in the sponsoring institution requirements. They pretty much tell you exactly what you need to have. We also provide different scenarios and discuss various sensitivities, and we identify any key decisions that need to be made. Finally, we present the feasibility study. There are no surprises. We address the key decisions. We try to get the group to come to a consensus on governance issues, on finance, on what the rotation schedule should look like. And everyone gets the same information so that they can make the best decision for their institutions and for the residency program that they're trying to build. I know I kind of flew through that. I think with that, we're done. So what questions do you have that I can possibly answer or that we can take back to Kiki?
Thank you, Maggie.
You're welcome.
Just a quick question. Can you unshare your screen so that we can see everybody in the gallery view? Thanks. Give people a chance to ask those questions.
There we go.
Awesome. Thank you. So does anybody have any questions? Do you have questions about the feasibility study that we conducted to lead to the psychiatry residency consortium as it stands right now?
This is Emily. I was kind of curious, and I don't know if there's like one answer to this, but when doing feasibility studies, is there like an amount of money that an institution should budget? Like how much do these typically cost, and about how long would you say they take to complete on average?
How long it takes to complete on average varies. We did one in Oregon. I think it was, we were up there for about 4 days. We were able to conduct all of our key informant interviews. Our finance team got on the data, and we were able to turn that around within a month. And then we started working with their boards as they were making their decisions to build a consortium and you know, do what they needed to do to move forward with the plan. Cost varies. I can have Kiki get back with you with a more definite, you know, with an actual amount for you if you were interested.
Oh, thanks. Yeah, that's not necessary. I was just kind of trying to get a feel for the ballpark, but thank you.
So I've been thinking a lot about those questions because, you know, we started the process and had a site visit November 14th, 2019, the same day that a $900,000 grant was announced to Butte County Behavioral Health for the psych residency. And so we kind of started the process thinking that we had that funding. And so probably not the best example, but one of the things I've been thinking about in preparation for this presentation is that it really does help to have that big picture thought in advance. And I'm going to say for a new residency program for a consortium to establish with GME naive facilities, it's upwards of $2 million to get going. And that includes the feasibility studies and the business plans, but it will cost more money than most people at GME naive facilities would ever dream of. And it's been an ongoing discussion point with our community as we've gone forward. There was this belief that we didn't necessarily need a feasibility study. We got the $900,000 grant. We got a good site visit with an academic institution in November. And we just needed to seal the deal and make the transaction happen. And then what we learned with Kiki's guidance and Maggie's as well in February and March of this year was the reason we weren't having any traction and moving forward with anything was that we needed to do the feasibility study and then, you know, had to negotiate what that cost was. But it's going to cost a lot more money than anybody in a rural community would be willing to pay. So I'm hopeful that organizations can understand that and help fund the feasibility studies and the business plans. You know, 2 million is not even ballpark for what it costs to do a feasibility study or business plan, but it's in the realm of a couple $100,000. And I'm really not pinning that on anything based on what we've been through, but on just sort of an estimate and why you would want to be prepared with that kind of a dollar amount, because it is just a lot of money and it's going to always be more than what anybody expects to pay at the community level. So 200,000 just to do the studies and the plans and make sure that everything's going, and then 2 million to get to ACGME accreditation. That's my take on it. I don't have data. I haven't surveyed other processes, but I'm saying that as the lead fundraiser for this psychiatry residency consortium. And that really has been my role. As it turns out, I didn't know that in the beginning, but you know, just trying to connect everybody so that we have the funding that we need to take all of these steps and really get to the finish line of having residents come to the area.
I think also when we did that feasibility study for you, Christy, a lot of questions came out that you didn't even realize that some parties had. You know, I think it made a big difference in actually knowing what was going on in the heads of some of these leaders in the community.
Right. And in general, I mean, so this is why the webinar series was created. Like literally in my head, I was like, okay, wow, the gap of knowledge is between let's just say there's a really intelligent, smart physician, but they haven't been in a residency program in the last 10 years. Their impression of what a resident is going to expect now, as opposed to 20 years ago, is vastly different. And I don't even know what those details are. I just happened to observe that gap of knowledge was there. And very few have actually been on the inside creating a residency program. And having all of what you just detailed with this presentation, it's just not in their heads. What we found out, and one of the great positives of doing this feasibility study and why I'm so passionate about it, is we identified a hospital with a fantastic, I'm going to use the word quotes, use this word because it's an actual word out of Kiki's mouth, was a phenomenal GME reimbursement rate. We had no idea. This gem was sitting right there. We knew they were a good hospital. We wanted to do residency programs, but we had no idea that their GME reimbursement rate was that high or even possibly that high.
And they didn't know either.
They didn't know either. And so just the value of conducting that feasibility study is far greater than simply because of that GME reimbursement rate that was uncovered. I'll just say this too, the weakest link that we had from the feasibility study was just, collaboration that we're going to be supposedly bringing together this consortium. We meet on November 6th, and we're going to make some more decisions at that point. Anybody's welcome to join us. We're going to try to meet in person in Chico and also have a hybrid Zoom going on as well. So we have some more decision points that we have to make going forward. But the weakest link, as with anybody would be, in any community, would be that healthcare facilities, clinical facilities, aren't usually working together, right? They're in competition with one another. There's territories. I think that the campfire actually brought our community together so that we could have these discussions in a positive way. But Kiki did identify, and Maggie too, that the weak link would be that we needed some more work to strengthen those collaborations. It's very valuable for us. All right, well, if nobody has any questions, I did hear that from Gregory Young at ARMC, no questions. And we will follow up. Do you think, Maggie, that the cost reporting section needs to be covered more in depth, or?
I would recommend, she's got some fantastic information on that. She has literally written the book on it. So I would recommend that she do, just even if it's just a short snippet in service on cost reporting. I would recommend that.
Okay. Excellent. So we'll set that up and hopefully have a chance to be able to email everybody who registered as a follow-up. And of course, everything will be recorded and online with it's actually a pretty short amount of time. I'm impressed with how quickly Physicians for a Healthy California can turn these videos around, but they're available on phcdocs.org in case others that you wish had seen this need to review the information. We do have recorded videos of all of these online. So, well, thank you all for being here. Thank you, Maggie, for stepping in and sharing this valuable information. If there's any follow-up, feel free to email me. I'm going to put that in chat. It's BGMS, which stands for Butte Glen Medical Society Executive Director, ED, @gmail.com. And we're always looking to share our story and really pull together our region. When you think about Northern California and the Oregon border, between Sacramento and the Oregon border, there are no other medical schools. UC Davis and North State are the highest points north. So we don't have medical education yet. Hopefully we can change that in the future. And so it's really hard to sort of get those academic affiliations going. I mean, it just takes those extra steps, even though we're not that far from Sacramento. And then some of the Humboldt and Del Norte folks are closer to Oregon, but we're making it work, and we're looking at regional approaches. So anything that can help us with a regional strategy is something that we could really benefit from.